This is Vegas Inc. with Dana Gentry and Jeff Gillen. We're minding your business.
Prescription drugs are killing Americans at an alarming rate, and when we come back, we'll tell you about an alternative to painkillers.
And prescription drug abuse is actually the #1 killer of adults in America, and that is chronic pain sufferers turning to alternate treatments.
Among them, a variety of spinal injections designed to block the pain at the source. Is it safe and is it effective? Dr. Daniel Burkhead is here from the Innovative Pain Care Center, where he treats chronic pain without prescription painkillers. Thanks so much for being here. Are you seeing a lot of people who are having a problem with prescription drugs and want to get off them for fear of becoming addicted, and that's why they're turning to you?
Yes, absolutely. We see patients every day that have been prescribed prescription medications, including opioids, for treatment of their pain symptoms. Which work okay to mask the symptoms, but then you can develop other problems related to the prescription opioids that you're taking, including the potential for misuse and drug abuse.
Are painkillers an easy way out for both the doctor and the patient?
I don't know if I would say that it's an easy way out for either the doctor or the patient. At times, it can be a reasonable answer for short-term acute pain symptomatology. However, when the pain is lingering for more than a few months, it's time to start seeking other causes of the pain, start to try to find out what is causing the pain and treating that pain at its source, as opposed to just simply masking the pain indefinitely with these potentially dangerous medications.
I've had 4 kids and 4 epidurals, so I'm assuming this is something like an epidural but with a longer lasting effect and not the paralyzing effects, correct?
That is correct, yes. We do a lot of spinal injection therapies in an effort to relieve patients of their lower back or neck pain. These are similar procedures that you would see done on the labor and delivery ward for ladies going into childbirth, except that we use a steroid medication to bathe the nerve roots that are affected by an inflammatory process that occurs when you have a bulging of some of the intervertebral discs. So in order to apply the steroid to the nerve roots directly, we use X-ray guided procedures. Patients are sedated. Often, one treatment will relieve the pain for the remainder of the patient's life, as the inflammatory process may never return. That's an opportunity to then decrease or potentially get the patient off their medications altogether.
Is there a growing awareness or acceptance within the medical profession to sort of back away, if possible, from painkillers, or let me just backtrack. Is there more of an awareness of over-medication, essentially, especially when it comes to pain?
Yes, absolutely. I've recently completed a Citizens Training Academy with the Drug Enforcement Administration, which was a fantastic experience, lasting approximately 12 weeks with 12 individuals from throughout the community, different realms of the community. It's very clear that the DEA is focusing on the prescription drug abuse problem in our nation. And this has many physicians concerned about prescribing pain pills, and it also has many physicians trying to better regulate their prescription of pain pills and make sure that the patients are doing the right thing with these pain medications, as opposed to releasing medications onto the street where they might be abused.
At the same time, are you seeing doctors take advantage of this? Because, you know, in Nevada you can have a license to dispense medication as well as prescribe it. A pain management specialist can actually prescribe the drugs and then sell them right there in his office, which to me sometimes seems like a conflict of interest. Does that concern people in your industry?
I think those practitioners that are trying to do the right thing for the public would always be looking for the minimal dose necessary. Whether they prescribe within their office or not, I don't think that that should play a role in the decision as to whether to start a patient on opioid therapy.
Well, that's interesting, and obviously an issue that's getting a lot of attention. Dr. Burkhead, we're out of time. Thank you for your time today. Appreciate it.
Thank you.